Okay, we have discussed gingival signet. We have discussed. Now we will start from embrasures. Triangular shape area present incisally and gingival and apical to contact area is known as embrasure. Gingival area don't filled with interdental papilla is called black triangle. There's a difference between impression and black triangle. Black triangle is an impression not filled by gingival interdental papilla. Okay. A black triangle due to loss of gingiva, sphere crowding, and corrected by proximal reduction. Okay, black triangle is because of loss of gingiva or sphere crowding, and it is corrected by interproximal reduction. Okay, maxillary central incisors are the brightest, while the canine are the dullest in the arch. Okay. Dental cast analysis. Dental cast analysis symmetry by placing transparent ruled grid over dental cast. Okay, transparent rule grid over dental cast so that dental grid axis is in the midline. Make it easier to spot asymmetries in the arch form. If you are unable to understand this point, just open your final year BDS orthodontic book. Okay, that is, I think, contemporary. Okay, space analysis. First step is calculate the space available from mesial of first molar to the contralateral side. Okay. Number 2, calculate the amount of space required by teeth. Okay, this is dental analysis and method for mixed space dentition analysis or radiograph proportionality table, which include Tanaka and Johnston method and Moyer method. These are the methods for mixed dentition analysis. Tanaka and Johnson analysis use width of lower incisor to predict the size of unerupted canine and premolar. Okay, uses the width of lower incisor to predict the size of unerupted canine and premolar. Sum of lower incisor width is divided by 2. Okay, sum of lower incisor width is divided by 2 and add 10.5 mm for mandible, and we will add 11 for maxilla. Okay, this is Tanaka and Johnson analysis. Okay, this is the method. Lateral incisor are used because of variation and first eruption. Okay, these are method for mixed space dentition analysis. What is Moyer methods? Moyer methods use sum of lower incisor to correlate the value in table. Okay, use sum of lower incisor to correlate the value in table. Okay, instrument used are cast, Boyle's gauges, and probability charts. Three things are used for Moyer's method that are caused, Boyle's gauge, and probability chart. Bolt-on analysis, also known as tooth size analysis. According to Bolt-on, there exists a ratio between the mesodistal width of maxillary and mandibular teeth. This is Bolt-on analysis. Okay, these methods are important, and dental cost analysis is also very important. Then we will talk about sphelometric analysis. This is also very important to see. Okay, so what is sphelometric analysis? Distance from X-ray source. The important points we are going to discuss. It says that distance from X-ray source to the subject mid-sagittal plane is 5 feet. Please remember this point. It is an MCQ. And from the mid-sagittal plane to the plane should be 15 centimeter. Okay, from X-ray source to subject mid-sagittal plane 5 feet, and from mid-sagittal plane to the plane should be 15 centimeter. Landmarks are anterior point of intersection, anterior point of intersection between nasal and frontal bone is known as nasion. Okay, you will understand it better when you will keep a picture of Ceph in front of you. Okay, this is just theory, this is quick review, this is a quick preparation for you any induction exam. Midpoint of concavity of salica is sella. Lowest point on the inferior margin of orbit is known as orbital. Midpoint of the upper contour of EOC is porion. External occipital, I think so, external occipital contour है शायद is porion. Okay, what is porion? Porion is midpoint of upper contour of external occipital contour is porion. Tip of anterior nasal spine of premaxilla is anterior nasal spine. Tip of posterior nasal spine of palatal bone at the junction of hard and soft palate is posterior nasal spine or PNS. It is not peripheral nervous system. Okay. Point at which the base of fissure where anterior and posterior wall meet is pterygoid point. Okay. Point at which base of the fissure where anterior and posterior wall meet is PTM. You will understand better when you will keep a Ceph with you. Lowest point on the interior margin is called basion. Okay. Uppermost point on contour of premaxilla. I will check diagram with it too when I will see this video. Lowest point on anterior margin is called basion. Innermost point on contour of premaxilla between anterior nasal spine and incisor is point A. Innermost point on contour of mandible between the incisor tooth and bony chin is called point B. Okay. Oh, sorry, diagram is below. It's important, very much important. Okay. Most interior point on contour of chin is pogonion. Okay, pogonion. Most inferior point on mandibular symphysis is menton. Here ME for menton. Midpoint of contour connecting ramus and the body of mandible is gonion. This is gonion. Okay. Center of inferior point on mandibular symphysis is gnathion. What is gnathion? Gnathion is the center of inferior point on mandibular symphysis. Here it is. It is gnathion. Center of inferior point of mandibular symphysis, gnathion. So here it is nasion. Here is sella, and anterior nasal spine, posterior nasal spine, and you will check the grid point to check this. This is lower facial anterior height. This is menton. This is gnathion. This is gonion. Okay. Horizontal plane. Ascent plane is also known as horizontal planes. We are going to discuss ascent plane. Ascent plane from sella to nasion, oriented at 6 to 7 degree upward, anterior to Frankfurt plane. Okay, upward anterior to Frankfurt plane, 6 to 7 degree upward is ascent plane. Okay.